thank you and Happy New Year to everyone joining us today, to all of our partners across the state, our media partners, especially who have remained with us for now 2 years of these media briefings on and off. And just want to say thank you to you. Happy New Year to all of you. I also want to thank Dr. Fatinos for joining us today, and Dr. Lindquist may be on for Q&A as well if there are any specific questions around epidemiology that may come up. I want to start by saying a couple of things. And first of all, we know that Governor Inslee and his team and our team yesterday announced a number of actions that the state is taking to take on this increase in activity and the concern that we have with community transmission as well as hospitalizations related to Omicron. And I want to make sure that everybody saw that announcement and the set of announcements, because it's a really important set of actions that the state is taking to protect Washingtonians. We know that with every new year, we always start with optimism, and we remain optimistic for where things are going to be as we move through 2022. But we do recognize that things are going to be quite challenging for the next several weeks or even longer. And we recognize that challenge is very much about Omicron. There are a lot of things that all of us have been doing together. And I just want to, first of all, thank our community members for everything that they continue to do during these last 2 years of fighting this pandemic. We need to continue to work together to help both our community as well as our healthcare system, our public health system, and everybody that's involved as part of the actions that people can take to do their part. But let me start by showing where we are with both cases and hospitalizations. And Dr. Kwan-Get is going to go through this in more detail. But as you can see, this is the case count curve, as we call the epi curve, for the last 2 years. As you can recognize, more so than me saying this, that the cases have been increasing, and not only have they been increasing, we have now seen an all-time high when it comes to the number of cases in the community. These are people who are testing positive, and this is very important because, as you remember, in the fall and winter of last year, when we were at our previous wave, we said things were really going to be quite tough in the winter of 2020 and 2021. And here we are now in 21 into 22, and we have an increase in cases. And not only do we have an increase in cases, we have a new variant that is now within our state. Not only are we seeing the increase in the numbers of people who are testing positive for Omicron or COVID-19 in general, but if I can go to the next slide, we're also seeing an increase in hospitalization. So if you all remember, when we were coming off the Delta surge, we were seeing a nice leveling off of community cases. We were seeing a nice leveling off of hospitalizations. And that was just back to the tremendous gratitude to all of our community members for working together. But now we have seen this increase. And while we have, by and large, been seeing or reading or being told, or the literature is saying that Omicron is providing more of a milder disease for the most part, more transmissibility, increases in numbers, but milder symptoms, there are still, when you have a lot of people who are testing positive, unfortunately, you have a proportion of those who are going to have severe disease and are going to be hospitalized. And we're starting to see that strain already on our already strained hospital system. So it is really important for us to continue with the messages that are really key for how do we fight this pandemic. We recognize that transmission will continue to rise in the coming weeks. We estimate that our new cases are now somewhere in that 15,000 range. We also recognize that our hospitalizations will continue to be very stretched and also be increasing over the next several weeks. So it's going to likely get worse before we start to see that New Year optimism of things getting better. But things will get better, and especially they're going to get better as we all, community members and partners, do our part. And I really want to go back to Governor's announcement from yesterday, the importance of in-person education for our students, the importance of keeping our businesses open, the importance of continuing to live in society, but also to take the appropriate precautions. As you know, the governor announced the at-home tests, the 5.5 million at-home tests that are the rapid tests that will be available in the coming weeks, with 1 million of those set aside for schools, another million for our partners on the ground, and 3.5 million that would be available to be ordered by Washingtonians. In addition to that, he made reference to the importance of masking up. And we know masking remains a critical tool. And as we all know that a lot of us have been wearing cloth masks, and, in certain settings, cloth masks, especially outdoors when you're not around other people, will be fine, will be okay. Maybe for a quick something, it's acceptable. But we also want people to really consider upping their masking strategy. And that includes whether it's true KN95 type of masks or surgical masks. We want to do everything we can for people to know that they should be upping their masking strategy. However, if people do not have access to KN95s or surgical masks, and the state is making available certain caches of surgical masks to partners upon request, that double masking is also an option. So the ability of taking a surgical mask and a cloth mask on top, the ability to take two cloth masks together if you don't have access to a surgical mask, there are things that people can do to protect themselves even now. And we want to make sure that people are doing those things. And as you can see in the graphic that's showing here, there are many ways to do this. We want to make sure people wear the masks. The most important mask wearing is the one that's actually being worn. And number two is that it has to be worn properly. I would rather that people wear a mask properly than they wear it improperly and think that they are wearing it properly, and guess what? They get into trouble with an infection transmission. So there's more information on our website. We're going to continue to remind people of the importance of masking. We're also reminding people of the importance of empowerment. And that means getting vaccinated, getting boosted, wearing the masks, and also risk appropriate activities. I think all of us know now, 2 years in, this is not new. All of us know what are the kinds of things that we need to do to be able to help ourselves, protect ourselves, our loved ones, those around us, our communities. And we need to be doing those things. Again, importance of boosters cannot be underscored enough. We know that the vaccines, especially if you've gotten your primary vaccine more than 5 or 6 months prior, that you are now eligible for getting booster. And in the case of J&J, it's even 2 months after. We want to make sure that people are doing whatever they can to get to their booster appointments. And why is this important? This is important because the state is doing everything that we can do to increase the capacity of booster availability, the capacity for COVID-19 vaccinations, the capacity for people to be able to get a vaccine as close as possible to them. Obviously, in some instances, people may have to drive if you want to get it sooner than a few days from now or a week from now. But we're doing everything we can to make that capacity available. But as the governor said yesterday, we can make the capacity available. We can do our part, but unless people are doing their part by getting the shot in arms or making sure their kids are vaccinated and or boosted, we are going to continue to really have people who are still at risk for Omicron. Omicron And the fight against Omicron really requires us to not just be primary vaccinated, but if eligible, to be boosted. I've already talked about mask strategy. I think that's really critical, but I do want to turn now to the importance of testing. And we've gotten a lot of questions about this. The first and foremost thing is that if you are sick and you have symptoms, not only do we want you to get tested, but most importantly, we want you to exclude yourself from others, to stay away from others, to not go out and expose others, to really do everything you can to protect yourself, your loved ones, and those around you. So as you can see here, the first and foremost thing is we want to make sure, as we are, and I know many of you have heard from our hospital partners this morning, that we are having a very difficult time in our emergency departments and our hospitals across the healthcare system, across the state of Washington. That means that we want to assure that people are only going to the emergency room or emergency department. Dr. Fotinas can speak on this as well, if they have an emergency. That does not mean that you go to the emergency department to get tested. That does not mean you go to the emergency department because you had a positive test and you're thinking that you might want to get it confirmed. That is not the reason to go to the emergency department. The reason to go to the emergency department are things like what you're seeing here. When you're having a true emergency, whether it's emergency from respiratory disease, whether it's chest pain, whether it's some other symptom that is causing you to have an emergent issue, we absolutely want you to contact 911, call 911, and/or make your way to the emergency department. But we do not want you to do that if it's not an emergency. So this is so critical to our healthcare system. If you have a home test, and again, we're working and more details will be coming on this with the additional 3.5 million tests that we have ordered. If you do have access to a home test, please, if you have symptoms or you've been exposed to someone, please use the test. If you don't have one, as Lacey said yesterday, it's like band-aids that, you don't wait for needing a test, you plan ahead and you get the test, and you do everything that you need to do to be able to have that test in your home so you can get tested. So I'm going to let Lacey talk more about that, but I think the key message here is that if you test positive, we want to make sure people are doing everything they can to, one, stay away from others, but also, number two, to be isolating or quarantining depending on whether they have symptoms or not. We have a number of pieces of information that are going to be going up on our website, but this is in summary what we want people to do. The CDC guidance, as you know, has evolved over the last week or so, and we want to make sure people are aware of the evolved guidance, the new guidance. Our guidance for Department of Health has also evolved, and so the guidance for isolation, quarantine, if you could keep that slide back up so I can read it, that would be great. But we also want to make sure that not only are people doing that, but they're also wearing the mask whether in home, and they're also doing the things to stay hydrated, using over-the-counter medications, and certainly being in areas that are ventilated, so we can really assure that people are not going to be in a situation where they're going to get themselves or others in trouble from COVID-19. Now you can take it down. We know there are constraints on our system, especially when it relates to testing. We also know it's related to vaccine appointments, although again, that is improving with the efforts that we have made alongside with our partners. And we know that's the case for the healthcare system. We ask all Washingtonians to please do your part. Please be patient. As we know, there may be some interruption of services, or maybe a point where it may take you longer to do something than you otherwise would do. We ask you to help each other, help someone, help a neighbor, help somebody in your community, especially as a very difficult time from a mental health standpoint for a lot of people, a lot of stress in the system. We want you to do whatever you can to help each other, and certainly empower yourself by knowing when to seek care and really keeping in mind what's happening in the healthcare system. Again, we are here to help. We have put forth policies, guidance, support, materials, supplies, resources. Again, back to the governor's announcement yesterday, all of the different support and actions that we have given for vaccines and community testing, at-home testing, masks, everything else, including the support in our healthcare system, all of this really comes down to one comment. Do your part, know what's happening. Yes, it's going to be difficult, but ultimately we are going to get through this difficult time together. And I just want to thank everybody for continuing to really work with us 2 years in. I know we are #Washington Strong, and we can do this, but we need to continue to be patient with each other and work with each other. So with that, I am going to turn it back over to our team here, and the reminder that it will get worse and things will be looking kind of bleak for a bit, but we do recognize that things are going to get better. We just have to continue to work together. So with that, Julie, I'll turn it back.
Thank you, Dr. Shaw. Now let's go to Dr. Kwanget. Go ahead.
Thank you. And could we show the slide with the case count epi curve, please? As Dr. Shaw mentioned, case counts have risen at really unprecedented rates in recent weeks, and our genomic sequencing data indicate that probably more than 80% of recent infections are likely due to the Omicron variant. Next slide. And so while Omicron has been able to evade immunity from vaccination better than Delta, vaccination is still so important. So as you can see in this graph, vaccinated populations shown in the green and yellow lines have seen a steep rise in cases, but rates in unvaccinated populations shown in the red line has been 3 times higher. So while vaccination is somewhat less effective against Omicron than it was against Delta, it is still so important because it greatly decreases your chance of infection. Next slide, please. Fortunately, we have not seen a rise in deaths, although it's important to keep in mind that changes in death rates can follow changes in case count, sometimes by more than a month. So this is something that we'll be following closely over the next several weeks. Next slide. And again, vaccination is the best way to protect against death from COVID-19. So as this slide illustrates, rates of death in those 65 years and older are 15 times higher than in the unvaccinated population than in those who are vaccinated. And so decreasing hospitalization and death is why all of us need to get vaccinated and boosted. And so this graph shows that, as Dr. Shaw mentioned, we are seeing a steep rise in hospitalizations in recent weeks. And we are hearing from many hospitals, especially those in Western Washington, that their capacity is becoming critically strained from a variety of factors, including staffing shortages exacerbated by Omicron infections and the need for isolation and quarantine. And strain on our hospital system is so important because it impacts care not only for those with COVID-19, but also those needing hospital care for other reasons such as heart disease, lung disease, and cancer. So again, getting vaccinated and boosted is the best way to protect yourself and the best way to stay out of the hospital for COVID-19 as it decreases your risk of hospitalization, as this slide shows, by more than 10 times. Unvaccinated individuals have rates of hospitalization, unvaccinated individuals 65 years and older have rates of hospitalization 13 times higher than those who are vaccinated. So our healthcare workers in clinics and hospitals who have done so much for our communities are exhausted and understaffed. And so it's so important for us to do everything that we can to support them. So as Dr. Shaw said, don't go to the emergency department unless it's an emergency. If you are sick and having mild symptoms, isolate and care for yourself at home, as Dr. Shaw mentioned. And finally, protect yourself from COVID-19 infection through masking, social distancing, and most important, getting vaccinated and boosted. Thank you, and I'll turn things back to you, Julie.
Thank you, Dr. Kwanget. Next is Lacey Fehrenbach. Go ahead.
Good morning, everyone. Thanks for joining us today. As you know, school is back after the winter break, and we are hearing a lot of questions or concerns about safety plans in place to protect students and staff from COVID-19 transmission, given the level of disease that we're seeing and also concerns about further outbreaks. We want to reiterate and really emphasize that in-person instruction is the best option for kids. There are a multitude of health, mental health, social, emotional well-being benefits in addition to the important value of education that in-person instruction provides. And layered prevention measures like vaccines, masks, improved ventilation, spending more time outdoors, staying home when we're sick, and being ready to respond to cases with testing, contact tracing, and isolation and quarantine make schools as safe as possible. We are planning to release some updates to our K-12 guidance later this week. We expect that to come out tomorrow. This update will include the updated isolation and quarantine guidance to align with the recently released CDC guidance. It will include expansion of the Test to Stay program, opening up that option to staff and to students who have community COVID-19 exposures, and also some further information to help schools with contact tracing efforts. As a reminder, schools can request additional test supplies through our Learn to Return program. We are expecting to see increased demand for supplies and needs for testing in schools in the coming weeks, given the degree to which Omicron is spreading in our communities. We also want to remind people that, because of the reasons I mentioned earlier, schools and in-person instruction should be the last thing to close and the first thing to reopen when it comes to trying to manage the spread of disease. So when outbreaks happen, classes, schools, or districts may need to switch to remote learning in order to limit spread. But if schools or districts are facing staffing challenges due to COVID-19 or having high absenteeism among their students, school leaders and local public health could consider limiting extracurricular or co-curricular activities to prioritize the maintenance of in-person instruction to the degree possible. And we certainly hope that temporary transition to remote learning happens at the most localized level as possible. In other words, you start by closing a classroom if there are signs of transmission there, or a few classrooms in your school, then the whole school if need be, and then potentially the district. The other really strong recommendation we have is that the children be fully vaccinated and the school staff be fully vaccinated and boosted. And certainly any of those students that are eligible by age to be boosted, and given the time frame of their booster, that they have those as well, in addition to following all of our safety protocols. I also want to talk a little bit more about testing. Again, anyone with signs or symptoms of COVID-19 or who is a known close contact of someone with COVID-19 should be tested, regardless of your vaccination status or prior infection. At-home tests or over-the-counter tests are super convenient. You don't have to leave your home, and the quick results make them a very powerful public health tool to help people take action quickly if they have COVID-19, to isolate themselves and to inform their close contacts, whether that's by phone or personal contact or through our exposure notification system, WA Notify. As noted by Governor Inslee yesterday and Dr. Shaw earlier in the briefing, we expect to have at least 5.5 million at-home tests here in Washington State by the end of next week. We are also hoping that that number grows. We continue to order more, and we'll do so through the month of January as we navigate this. We're working with Care Evolution and Amazon to build upon an existing infrastructure that was established through the federal Say Yes to COVID test program and enables statewide ordering of at-home tests. We expect that to launch, we're hoping, the week of the 17th. This program, the federal program, ran in a few counties in Washington State in the fall, November and December, and distributed over 800,000 tests to households in the counties that participated. We're going to expand that infrastructure to distribute at least 3.5 million of the at-home tests we've procured. And initially, that will give us the ability to reach 700,000 households with a kit of 5 at-home tests. We do plan, based on the supply we have now, to limit households to 1 test. That could change over time if we're able to get additional supply. We're also distributing at least 1 million at-home tests to local health jurisdictions, tribes, and other local priority partner organizations. Actually, about 200,000 of these have already started going out the door this week. I want to emphasize that these tests are for these key partners in local public health tribes and local communities to use based on their needs at the local level to close testing access gaps or to reach key groups of people in their community who may have trouble accessing an online portal or who are at risk for severe COVID. So examples would be people living in long-term care facilities or homeless shelters or key community organizations. So we do really want to emphasize that we expect most Washingtonians to use our online portal that we're building in partnership with Amazon and Care Evolution, or to purchase their tests at pharmacies or online retailers if they would like to get an at-home test. We are also moving at least 1 million of these at-home tests to schools through our Learn to Return testing infrastructure. And that's really to help our schools stay open and students in the classroom to the greatest extent possible. In the meantime, as we build out these things, people should use the testing sites in your neighborhood, check nearby pharmacies, and again, want to emphasize, take a test if you have symptoms. Dr. Shaw mentioned this, but please plan ahead and keep a box or two of tests in your home medicine cabinet. Think of them as a standard first aid item in your home. Together with vaccines, masks, improved ventilation, testing remains a critical tool in our fight against COVID-19 and a way that you can ensure you're doing everything you can to protect your family, household, and broader community from onward transmission. Thanks. Back to you.
Thank you, Lacey. Our final panelist is Michelle Roberts. Go ahead, Michelle.
Well, thanks, Julie, and thanks, everybody. We're glad you can join us today, and Happy New Year. I'm Michelle Roberts, and I lead the state's COVID-19 vaccine planning and distribution team. As usual, I want to start by giving an update on our state's vaccination progress. This week, we updated our data to include everybody who is eligible for a COVID-19 vaccine, which is now everybody age 5 and older. The great news is more than 77% of people age 5 and up in Washington state have received at least one dose. That's phenomenal. And nearly 71% of the eligible population is fully vaccinated. We've given out more than 12 million doses of COVID-19 vaccine across the state, protecting more than 5 million people from the worst outcomes of this disease. But as we all know, our work is far from over. We know that COVID-19 vaccines work very well to prevent severe illness, hospitalizations, and death. But protection does decrease over time, which is why booster doses are vital, especially with Omicron on the rise. Statewide, nearly 2 million people have received an additional dose of COVID-19 vaccine, which includes booster doses and third doses for those that are severely immunocompromised. That means nearly half of everyone currently eligible for an additional dose has received one. This week, the CDC did update its recommendation for when to get a booster. People who received the Pfizer vaccine should get a booster at least 5 months after completing their primary series. That's what's new this week. People who received the Moderna vaccine should get boosted at least 6 months after their second dose. And people who received the single dose Johnson & Johnson vaccine should get a booster dose after 2 months. The evidence is increasing all the time that it is really critical that everybody who is eligible for a booster dose needs to get that vaccine to have the best protection, both against infection and severe outcomes of COVID-19. Some other good news is just yesterday, the CDC's Advisory Committee on Immunization Practices recommended booster doses for everyone age 12 and older. This includes my daughter. We expect formal guidance from the Western State Scientific Review Work Group today. And once the recommendations are finalized, we'll send out updated booster dose guidance to our vaccine providers, the media, and community. So stay tuned. That will happen later today, and we'll start getting those 12 to 15-year-olds their booster doses. We know recently there have been a few recommendation changes to boosters. So I just went through some of them, including age groups and timeframes. So if you have questions, please reach out to your trusted healthcare provider, or you can visit our Department of Health's Frequently Asked Questions page. It's important we all work together to spread factual information about the vaccine and help stop the spread of this disease and protect people from the worst outcomes, which leads me to my next topic, getting our kids vaccinated. So over the past 2 months, nearly 190,000 kids aged 5 to 11 in our state have received their first dose of pediatric vaccine, and more than 130,000 kids are now fully vaccinated. I'm proud of our state's progress, but that means more than half of our eligible younger kids remain unvaccinated and unprotected. We do know that kids can get very sick from COVID-19 and have both short and long-term health complications from the disease and spread it to others, including at home and at school. Vaccinating children can keep them in school and help them safely participate in sports, playdates, and other group activities. To further protecting our younger children who are moderately and severely immunocompromised, the CDC is also now recommending that certain 5 to 11-year-olds receive an additional dose of vaccine 28 days after their second shot. At this time, Pfizer is the only vaccine authorized for people under 18. For more information, again, please visit our frequently asked questions page, where we have a whole section about vaccinating youth. So in closing, I just want to remind you to find vaccine locations near you. You can visit the state's vaccine locator website or vaccines.gov. If you have questions or need help making a vaccine appointment, please call the state's COVID-19 hotline at 833-VAX-HELP. And before I close, I also want to remind everyone to get their flu vaccination. It's your best shot at protecting yourself from the flu, including severe side effects from the flu and any chance you have to end up in the hospital because of the flu. Thankfully, flu activity remains low in our state at this point, but it is increasing. We recommend a yearly flu vaccine for everyone 6 months and older. It takes 2 weeks for the vaccine to work, so please do not wait. Take these simple steps to protect yourself and your family this season. Thank you.
Thank you, Michelle. We are now at the question and answer portion of our briefing. We have 22 minutes left and 6 reporters in the queue. We will begin with Ryan from Como. Go ahead.
Hi, good morning, and thanks as always for making yourselves available to us. On the topic of boosters and the time frame between them and the initial series, we're now at a place where all 3 of them have different lengths of time before you should get your booster. We're seeing data from overseas and practices in other countries now where they're recommending boosters after 3 months. Do we have any plans to consider this, and would you actually consider even going beyond federal guidelines and making that recommendation as the data continues to emerge?
Thanks, Ryan. Michelle, go ahead.
Yeah. Great question, Ryan. And you make such an important point. The information we're learning and the science is evolving very quickly right now. And there is kind of a spectrum across different countries and nations about booster dose intervals. And some of those are coming from when people have different waves of disease. Including, Omicron was seen first in other countries. For right now, it really is incredibly important we follow the CDC and FDA recommendations on booster doses and intervals. And we also have the Western State Science Work Group here. They're really looking comprehensively about the data and the science to make the best decision. There is protection from the vaccines. They're not fully, your protection doesn't turn on and off, as Dr. Shaw likes to say. It is a continuum. Getting the booster doses is helping boost that and increase your protection. But right now, feel pretty confident in the intervals we have. We'll continue to learn more as time goes on, and we'll see what may happen next. One other piece I want to recommend for providers in the US, we do need to operate, and it's part of the COVID vaccine provider agreement, that the providers who have COVID vaccine, which is a federal asset, are following the recommendations of the FDA and CDC.
Thank you. Our next question comes from Ariel with the Spokesman Review. Go ahead.
Thank you and Happy New Year. I have 2 questions this morning. First, we heard from hospitals earlier this morning that they are closer than they've ever been to crisis standards. And I wanted to ask what it would take for the state to declare crisis standards of care and how many hospitals would need to be at 100% or over that capacity for this to happen? And then secondly, I'm curious if DOH has any plans to open more or continue to keep open COVID-only long-term care facilities to help hospitals discharge patients who no longer need to be there. Thank you.
Thanks, Ariel, and Happy New Year as well. I'll take maybe a quick set of comments on this one, and then maybe either Andy or Dr. Fotinos or someone else on our team may want to talk a little bit more, maybe in depth about what's going on in not just the healthcare system, but the entirety of that health acute care, and also what's going on in long-term care facilities. So from the standpoint of crisis, and Ariel, I think you'll recall that we had this conversation when we were in the middle of the Delta surge, and it was a similar discussion at that time. And in fact, I just want to remind you that Department of Health, in coordination with the Northwest Health Response Network, as well as the READY Coalition, as well as the Washington Medical Coordination Center, WMCC, as well as the DMAC, the Disaster Medical Advisory Committee, had published a set of guidelines back, I want to say, in about probably late October, November timeframe, if I have that correctly. And it was really outlining how we would go about looking at crisis standards of care. Again, there's a continuation of this need for the, whatever we call it, at the end of the day, we know the hospital system, the healthcare system is strained. That said, we also recognize that there are many things that can be done in the midst of that strained system to be able to support, whether that's within the institution or whether that's outside of the institution. For example, at a local public health level with our local health jurisdictions, or from a state level, from Department of Health, Healthcare Authority, Department of Social and Health Services, et cetera, all the state agencies. What can we do to support our healthcare system? And obviously another piece of this, as I mentioned earlier, was just community members doing their part. So there, Dr. Kwan-Get made a very cogent point around staff shortages. And I think that is a key driver right now. So you may have beds, but you just don't have the staff to operate those beds. So as we laid out this information previously, we stand by it at this point, which is there is a difference between what's happening in what we call more contingent situations, or even in situations where care is being provided within a crisis, but not necessarily all the way up to crisis standards of care. Crisis standards of care would be at that point where every institution across the state have no other way to either move patients or the people who are seeking care to other alternate places or other colleagues across the system, east, west, north, south, and also that there is an inability for resources to be coming into the healthcare system to support. We're obviously not there yet, and we want to do everything we can not to get there. But that does mean that there are a lot of things that are happening within the healthcare system, and that's where I think Andy and Dr. Fotinos and others may be able to comment on. But it is really critical for everyone to remember that we have already put out there and published what our crisis standards of care guidelines are, and also what we believe would be the triggers that would get us to the point where we may have to enact these, such as what was done in other states. But again, the reminder that we're going to do everything we can not to ever have to enact those in the state of Washington. Andy, Dr. Fotinos?
I'm happy to start with an update related to long-term care from yesterday. There are 84 beds in the state that are in COVID units, long-term care facilities. As of Monday, I believe about half of those were full. And the Aging Long-Term Services Administration is looking to stand up more of those beds so people can transition from the hospital into long-term care facilities. As you might imagine, it's a process. The hospital identifies someone who needs to be transitioned to another place of care after their acute illness is over. If that is a long-term care setting, then that person needs an assessment to figure out what level of long-term care they need. They then need to find a facility in which to go for that long-term care. At every one of those places, staffing shortages are impacting what is usually an involved process. So in some of the regions of the state, some of the staff that work for the Aging and Long-Term Services Administration are out. So they're not able to handle the volume of assessments, which are now increased because more people are sick. And at the long-term care facility side, staff are also impacted and out ill. So what you're seeing is a lot of people at pretty much every step in the chain of moving through the healthcare system that are out and slowing things down. We will continue at the Healthcare Authority and long-term Aging long-term care supports to provide incentives to nursing homes, which we have been doing for the last few months, recognizing that the care people will need once they get there will be more involved and staffing. So still trying to, from both the Healthcare Authority and DSHS, try to support the long-term care facilities as much as we can with those incentives and meeting regularly to help move people into the appropriate location once they're ready to leave the hospital. Andy, I don't know if you want to add any more to that.
Yeah, thanks. Couple things. There's a lot to unpack here, but just on the long-term care piece, we will also continue at DOH to support our partners at Department of Social and Health Services, DSHS, and their needs for staffing to support the long-term care facilities in these specific locations to discharge COVID-positive patients to the best of our ability. But let me back up just about 5,000 feet and give you a quick update on some of those other pieces, because I know there's questions in the queue about this. So we continue to focus on three main parts of the hospital surge piece. It's the ingress into the facility, how we support our hospitals and healthcare systems with the surge that they're going through, and then as we just talked about, the egress piece. So really, one of the things we're really paying attention to is the impact to our hospital systems to continue to deal with the surge is staffing. It is a majority about staffing. We know that a lot of the staff in the hospital systems right now are out sick, having to go through isolation and quarantine, but a lot of that is from community transmission. So the ask from me to you is this, as part of what Dr. Shaw mentioned this morning, help protect our healthcare workers. We continue to want to eliminate them from having to have to come into contact with this virus in the community. So do your part, isolate, quarantine, test, vaccinate, all of those things we talked about this morning. It is not just for you, but it also is part of that protection for our healthcare workers and those that are critical in our community to help support the work in the hospital and healthcare systems. We continue to support staffing efforts across the board. Our ACI contract continues to be utilized, not to its fullest extent at the moment. So we're continuing to work with our hospital association and our hospital and healthcare staff to help them understand what's available and to take advantage of this contract that we have. Currently, we have 21 facilities across the hospital system that have utilized 891 staff. But over the last 2 weeks, I only have 3 requests in the system from hospitals for staffing. So we know they're busy, but we continue to leverage what we can at the State Department of Health and the state as a whole for federal, local, and contractual resources and make those available as they can be. Last thing I'll just mention really quick is, these hospitals that we are hearing about the surge from have had plans in place for many years. They're called surge plans. They are executing those plans throughout this pandemic as they need to create the space and the stuff that they need to be able to treat patients. So we have not found yet that any hospital facility is out of space. Really what this again comes down to is staff. So we continue to support them with staffing, but I'll just reiterate the ask one more time. For those that are available out there that can volunteer, that have time in your busy schedules and busy lives to want to be part of the effort, we have a system set up on our website for how medical volunteers can register, whether you're retired or currently licensed in the medical field, to participate and be part of the solution, whether it's a few hours a day or what a lot of our systems are looking for, which is significant asks of time, for weeks and hours throughout that week to support them. But also to just do your part as far as vaccinating, isolating, and quarantining, testing to help us eliminate community transmission, to keep our staff in these systems safe so they can come to work. So just want to make sure we cover all those bases and glad to clarify if there's anything that I need to. Thanks, Dr. Shaw.
Oh, perfect. You guys, thank you, Dr. Fatinos and Andy. I think you covered that answer quite well. So, Julie, I think we're ready for the next one.
Andy wasn't kidding when he said there was a lot to unpack there. All right, I think he covered it though. The next question comes from Lisa at Coin. I'm asking on her behalf. She says, what's the plan to help Clark County with shots and testing? There are no large clinics and people are telling us they can't find appointments or walk-ins.
I think the first thing is, obviously we're recognize the important role of the local health jurisdiction there and what their efforts are with their partners on the ground. So I want to make sure first and foremost to really highlight the work that's happening in Southwest Washington. In addition to that, we have opened, as you know, the high throughput site, which moved from Federal Way to Auburn this week, and we have a plan for an additional site in Northwest Washington, as the governor had outlined yesterday. We do not at this time have plans for any high throughput sites to be open in Southwest Washington, and specific to answering this question, but we are working with our partners with our caravan efforts, our mobile efforts, and even mobile teams on the ground that are going throughout the state. So I think there's a lot of behind the scenes efforts that are happening. I don't know if Michelle or Andy, if you had any additional pieces, but I do think that first and foremost, we want to make sure that our local health jurisdiction has the support and visibility, which I'm sure they do, on what's happening in their community.
Yeah, I'll just add that booster doses, just availability and demand were really impacted the last couple of weeks due to the holidays and weather events. And we're just seeing that start to rebound this week. So our doses per day and 7-day average dropped significantly. But as we keep compared to where we were before the holidays and compared to the capacity that our health system tells us they have, which is close to 60,000 doses per day. So there is a lot of capacity out there. We're watching that really quickly and looking for parts in the system where you said there is stress. There's way more capacity for mobile teams and in the primary care system and just out there compared to when we really had the need, a year ago for the mass vax clinic. So we're working on those pieces. Any local health jurisdiction or partner can request our mobile teams to come in to help increase capacity if there is tight spots. So that is a piece there. But like Dr. Shaw said, we do look first for the local health departments. And I do know Clark County has been working on ramping up their own mobile teams recently as well. So we'll be monitoring it closely. And I don't know, Andy, if you have anything else you want to add.
Yeah, just real quick, I think I also want to make sure folks continue to emphasize our hotline. It is there for a purpose to help support anybody continue to find appointments, vaccine, testing, or otherwise, even if they just have questions. And folks also have to know, a lot of people are seeking post-holiday testing and vaccinations, which is great. So you may have to travel a little bit outside of your normal comfort zone with, I have a place I like to go get my vaccinations and my supplies from my pharmacy down the street. But I know a lot of other people do too in my community. So I've had to find some alternate places to go to. So you have to be a little creative and be willing to travel just a little bit. But I think the hotline is there to help for those that are not technologically advanced or have access to some of the systems some of us do, to continue to search and look for that appointment when we want it. So take advantage of it. Share that number with your friends and family and let them know that they're there to help provide that support and help them find that appointment that they need.
Yeah, and then the other two reminders that we've said a few times previously is please do not hold on to multiple appointments. If you get your vaccine or about to get your vaccine, go ahead and cancel the additional appointments. And the other is do not wait for the perfect booster vaccine. The best vaccine from a booster standpoint, even primary vaccine, is the one that's available to you. And so get your booster and do not shop around to get the perfect one. We want to make sure you are protected now and not waiting for some period of time to get the one that you're desiring, and then in that interim period you get infected and get sick from COVID-19.
Thank you. It is now 11:10. We have 5 minutes left in the briefing, but 4 reporters left in the queue: Nicole, Amanda, Steve, and Patrick, and we will get to all 4 of you, even if that means running a few minutes long. So just wanted to make everyone aware of that. Nicole, go ahead.
Good morning, everyone. This morning, the State Hospital Association said that there are likely many more people who are sick than what we see in the charts because people aren't reporting the results of home tests. I know that you said before that better surveillance is needed. So what are the plans for that? And then also, over the autumn, I was in Germany and Austria, and this was even before the Omicron wave. Vaccine proof was required in any dining or entertainment venue across the board, and in every single store, N95 style masks were required to enter the store. Why haven't we seen anything like that here on a statewide basis, and could we see that in the future with this wave?
Thanks, Nicole. I think first and foremost that we've made it clear, and Governor Inslee has made it clear that we continue to look at all modalities of what we need to do to protect our communities. And at this, we've had discussions about various strategies, but at this time, we do not feel those strategies are necessary. Obviously, if things change, then we will have to continue to re-strategize, and that is the honest answer to your question. When it comes to the Hospital Association and their comment about undercounting, I would say wholeheartedly, I agree. I think this is an issue of public health right now across the country. We know, and by the way, it's going to likely get even more so the case when you have more at home or tests that are available to people, and we want to empower people to be able to do things once they get a test result. And that's one very important tenet, is to empower people with knowledge of what actions they should be taking. But at the same time, part of that, and we can certainly remind everybody for the importance of WA Notify and our 800 number and ways that people can report if they have a positive test. But at the same time, I do want to make it very clear that we are likely going to continue to have a difference in people who are truly positive for COVID-19 and our numbers. And so many public health practitioners across the system, and even within Department of Health, we've been thinking and strategizing behind the scenes on, at some point, you have so many numbers, and the numbers may or may not actually reflect what's happening in the community. So at that point, you don't count as many of the numbers. You really focus on two or three things. One, you focus on what Dr. Kwan-Get laid out, which was hospitalizations and deaths. Number two is you focus on outbreaks. And those are the two areas that we have really very much emphasized. And so we even shy away at times lately of thinking about what do the numbers mean, because one, there are a lot of numbers, and number two is that those community numbers may very well underrepresent what's happening truly in the community with at-home tests and ability for people to get testing and or not even seeking a test and or not reporting a test result. So there's a lot there. We're already there in terms of our conversations within Department of Health and what does this look like. And I will tell you, speaking with colleagues across the country, this is a very similar discussion that all public health entities are having right now, is what does it mean as we move into these newer phases of this pandemic 2 years in, where it's not as much about the numbers of cases, it's really about the severity of those cases. And that's what we're really wanting to focus on. I hope that helps. Lacey, I don't know if you had any additional to that.
Well, and just a quick note, I'm going to give the number in case anyone doesn't have it, but you can call and report your at-home test results to our hotline at 1-800-525-0127, 1-800-525-0127. We launched that capability in August, and we've had just over 1,000 results reported to us August through January 3rd. As people have learned about this, and as at-home tests have become more available, the volume of people reporting those positive results has increased. We fielded 90 on Monday alone. So 1,000 over several months, 90 on one day. People are availing themselves to this, and we're grateful for those Washington residents that do. Number one, it does, to your question, help us know and have a better view of what the disease burden and trajectory looks like in our state. But importantly, it also connects these folks to case investigators and care coordination services if they need them. And then as Dr. Shaw mentioned, if you are a WA Notify user, you can notify us of it's actually not us, you can notify your close contacts of your positive result with an at-home test. So you can request a notification code, and that doesn't necessarily inform our surveillance efforts, but it does serve a public health purpose in that you are really quickly letting the people who are around you know that they may have COVID-19.
Yeah, and Nicole, this is going to continue to be a challenge for public health across the country. And so we are very much mindful of working with that. We've had conversations with our local health departments as well, our partners on the ground. And, all of us recognize the importance of testing, but that's why we spent so much detail at the very beginning of this briefing on how people can interpret their test results, what they should do, when should they seek emergency care, and when they should actually do certain things. And that is going to continue to be our message on social media. It's going to be our message on our website, and we hope you will help amplify that message for people.
Our next question comes from Amanda at the Seattle Times. Go ahead.
Hi, everyone. I was wondering if you guys are aware of the letter that was submitted by the Washington State Medical Association. I think it was submitted this morning or in the last hour, but it's essentially asking the governor and Dr. Shaw to declare a statewide crisis and open up resources to help emergency departments. I was wondering if you guys are all aware of this letter and whether you have a response on whether this should be declared a crisis and what resources that would make more available.
Thanks, Amanda. I'm not aware of that letter. And so, you're saying that it came or is coming to the governor and myself. I have not seen it, so I can't comment to the specifics of the letter, but I will say that, we do believe that we are in a very difficult time in our healthcare system. I was in a hospital just yesterday afternoon. I will tell you, it's a very changed environment. And so we recognize how difficult things are. We have already, as Andy exhaustively pointed out, have opened up a huge number of resources. Dr. Fotinos and our partners at not just HCA, but DSHS are doing an amazing job of really all the support that we can provide to our healthcare system. We have already opened up an incredible amount of resources and support for our healthcare system. And at the same time, we recognize that, some practitioners, or maybe more than some, feel that maybe more should be done. But I will tell you that we already have been doing a tremendous amount. We will continue to do everything we can. And all of us have a part to play in this, including our healthcare system, as well as our community. And certainly the state will be there to support as best we can. And certainly at the same time, we will continue to be mindful of what the real challenges are within the healthcare system. And we are even planning some additional conversations with our healthcare systems so that we can really talk to them about some various ways that they can utilize some of those supports that the state has available.
Our next question comes from Steve at Como. Go ahead.
Hi, thanks, Julie. I hope you can hear me okay. I'm going through the tunnel currently, but I wanted to get back to the issue of testing. I know there's a lot of frustration out there about people not being able to get a test, whether it's after travel, whether they've been in close contact with someone, whatever. If somebody can't get an appointment to get tested because there's so much demand, if they can't get an at-home test because they're so difficult to come by, shouldn't go to the ER to get tested, especially if they have mild or they're asymptomatic. What does that person do? Is it simply just kind of waiting out until something does become available and try to go about life as best they can? Or what do you tell to those folks? Because it's so hard to get either an at-home test or get an appointment to get tested.
Yeah, Steve, that's a complicated question. I know it's a simple question, but maybe it's a complicated answer because it depends on what you're asking and how deep we want to go in this. And certainly Dr. Quanget or Dr. Fotinos may have some additional thoughts. I would say one thing that Andy highlighted is that, yes, I mean, post holidays and coming back, especially as Michelle said about weather and what impacted both testing and vaccinations over the holidays. And now we're coming back, as you said, Steve, that people are coming back from travel and they want to get tested, or they want to, have some other aspects of this. That's absolutely critical. So we know that there is demand. We just don't know for how long that demand will continue to be higher than otherwise. So there's an element of patience that goes into that. But the other piece of this, which, and I'm thinking back to all of my, this is where I'm looking at Dr. Coinget and Dr. Fotino's, all of my trainings and all the different infectious disease activities that I've been involved in over the decades. I will tell you that there comes a point where you provide empowering information, you provide education, you provide health awareness to community members, to individuals, to patients. And then at the same time, you also have an opportunity to say, as part of that, look, if you're not sure, or if you can't get the test, then act as if you have what you are otherwise concerned about. And so in this case, if you've got symptoms and you can't get a test, instead of frantically saying, I've got to go and clog up an emergency department, your symptoms are mild, and further the strain on that healthcare system, you stay home. You isolate. Or if you don't have symptoms, you've been exposed and you can't get a test, you quarantine. You wear a mask. You get your booster. You social distance. You wash your hands. You're careful with everyone around you. You're not going to a concert, or you're not going to a game. You're staying away from areas where you are potentially exposing others. So, Steve, I think really getting in on this is deep, but it's really, at the end of the day, what I call risk appropriate activities. If you feel you're at risk because you have COVID-19 and you can't get a test, there are activities that you should shun away from. And you do that for not just a day or an hour, you do that for at least 5 days. Maybe you do it for 10 days. But you don't just act as if everything is fine, I'm just going to ignore it, because that's when you get yourself as well as others around you in trouble. So that's a very strong sentiment for me over 20 years of infectious disease response, is that you have to really do everything you can to think about you, and as part of the community, you, and how you can really improve and help the community through this very difficult time. Dr. Coinget or Dr. Fatinos, anything that I may have missed, or your thoughts on this?
No, I think my thoughts would be similar. It is a very difficult situation where testing availability is not nearly as plentiful and adequate as we would like it to be. So until it improves, I think the safest thing to do is, if you have viral symptoms, to assume it's COVID-19. There aren't any ways to tell just by symptoms whether a viral illness you have is from COVID-19 or another respiratory virus. So if you do have symptoms of a viral infection, really the safest thing to do is assume that you do have it. And as Dr. Shaw mentioned, it's really important to make sure that you don't go out into public places with symptoms and infect others. And within your circle of family and friends, want to be especially careful around those who have chronic conditions that might place them at higher risk for severe illness or even death. The last thing you want to do is have a viral infection that for you might just be a minor cold or a low-grade fever and uncomfortable but an inconvenience. But for another person, a friend or family with a chronic condition, for them could be life-threatening. So really, as Dr. Shaw mentioned, I think the safest thing to do is, when you have symptoms and don't have access to testing, is to assume that you have it and act appropriately.
I would just add that this sounds like a different message than what we've given before, and in a way it is. And in part it is because what we're learning about Omicron is it's a little bit different. It is certainly way more infectious. A lot more people are going to be infected. But we also know, to the best of our knowledge that we have and from other countries, that fewer people, particularly those who are vaccinated, are boosted, get seriously ill and or die. So when this all started, we didn't know any of that. You know, we knew people were getting sick and dying, and it took a week, and we were really concerned and wanted to do our best to stop the spread of infection. Now that's kind of hard, right? Because Omicron just goes where it wants to, essentially. So the message you're hearing from us is a little bit different. Like, yeah, you might not be able to get a test, but this is probably behavior we should have been practicing for years. We power through it. We go to work when we're sick. We try to do everything when we're sick, and now we're saying don't do that. You know, and so I think the narrative does sound different because it is a little bit, but I think the circumstances are a little bit different too.
Thank you. Our final reporter question comes from Patrick at Cairo. Go ahead.
Hey guys, thanks for your time today. I know this has been extended and I appreciate that. The last question, kind of on the heels of what Dr. Fatinos was talking about, yes, based on all of the initial research, it does look less severe, but I'm curious about treatment efforts that the state is pursuing or currently has. From talking with some hospital executives, they mentioned that antibody treatment doesn't work as well against Omicron as we've seen, maybe against Delta. So I'm curious if the state has received the Pfizer pill, if that's in the works. If so, how much? If so, how do you plan for it to be distributed as we're seeing hospitalizations creep up? And yeah, just curious about the state's approach to treatment. Thanks.
Yeah, Patrick, I'll take a stab at that, but maybe I'll turn that over to Lacey, Andy, or Dr. Quangat on this one, or maybe Dr. Fatinos has an additional comment. But I would say overall, this is the real challenge throughout this pandemic, that it's not just the state of Washington, it's 49 other states, it's the 6 territories, it's large local health jurisdictions, as well as every local health jurisdiction, its partners, its healthcare system, it's the global environment. There are so many supply chain issues that go in throughout this pandemic. It was initially, as you know, it was about testing, and then it was around epidemiology capacity around contact tracing, and then it was vaccines, and then it came back to what about testing, and then it went to what about boosters, and in the midst of that we had masks. And I mean, this has been an ongoing supply chain challenge throughout. And the reality is that as much as the federal government has been so supportive of states like ours to be able to get the supplies that they have to us and work with us, the challenge is there just aren't enough supplies or therapeutics to go around. And so every time we as a state have been working towards a plan, the challenge has been, or the concern we've had, is that frankly there just aren't enough of that X, Y, or Z to have a cogent plan to be able to roll it out in a way that we feel is going to really be as helpful and as effective. So what do? We do the best we can to prioritize. We do the best we can to work with partners where we think that it is going to be able to get out to the appropriate community members. We do our best to champion the messages. We do our best to get more supplies and do everything we can to get on the phone or on the online to be able to get the supplies in, and do everything we can to get those into the state of Washington. So Patrick, I think that's where we are when it comes to both monoclonal antibodies as well as antiviral treatments. But again, let me turn it to my colleagues if they have some additional specifics on because I think your specific was around antiviral. So I just want to make sure that we have that question answered, and then maybe more on monoclonals as well.
Yeah, I think the only thing that I would add is that, we are in this difficult situation where the manufacturing capacity for these medications just isn't nearly enough to meet the demand. So the federal government allocates each state a certain supply to distribute it evenly throughout the country. And then within our state, we have a distribution plan that attempts to distribute it equitably. And as Dr. Shaw mentioned, prioritizing those who are at highest risk of hospitalization or death from COVID-19, because those are the people who can benefit the most from these antiviral products.
And that concludes our reporter questions. Dr. Shaw, do you have any closing remarks?
Actually, I want to first turn it over to Dr. Fotinos. Just really, again, the appreciation for her and Healthcare Authority for joining us today. Sharisa, I don't know if you had any additional thoughts you wanted to share as we close. You always have incredible amounts of wisdom. So I was going to give you the opportunity to say something before we close.
No, I appreciate the opportunity and just want to share that this is a statewide effort. We talk to each other more and we know more about each other's pets and children's than we did when this started. And that's, fortunate to be in a state where people are committed and working so hard. And I think that I would just reiterate, this is uncomfortable. It's not something we've experienced before. We're all tired. We wish it were over. And we still have to do all the things that we've been doing for the last 2 years, even though we wish we didn't have to. If our pattern follows that of other countries, we know it's going to be a rough couple of weeks, but then things are going to calm down again. So I think looking out for your neighbor, watching out for each other, continuing to have all the grace that we've all shown so far is all I'd add. And again, thank you. And to the healthcare workers who have got to be exhausted and tired, and my friends, thank you. Thank you so much. I know you're tired. And I wish we could do more than we can, but know what we're continuing to do all that we can to support you at the state level. Thanks, Dr. Shaw, for the opportunity.
Absolutely. And thank you, Healthcare Authority, as well as DSHS and other state agency partners who really have just been amazing to work with. So really just want to thank you for joining us today. I also want to thank my colleagues at the Washington Department of Health for joining today. And I want to thank again our media partners. I think we covered a lot of things today, the importance of boosters, the importance of upping your masking strategy, the importance of testing, the importance of all the different empowering activities to really know what you can do if you test positive, or as the question was asked, if you don't even have access to tests, what you can do to protect yourself and those around you. I want to continue to remind everybody, as Dr. Fotinos just said, that we are going to go through some difficult times here, some challenging times, some really hard period over the next several weeks, and we don't know what that's going to look like on the other side in terms of how long it's going to be, but we do recognize that when we all do our part, when we all are patient with each other, when we do our part working in the system, including truly supporting our healthcare system, not just by buying a cup of coffee, but really doing our part by getting boosted, vaccinated, and not using or overusing the healthcare system unless we truly absolutely need to do that, we will get through this quicker than otherwise. And I really just want to thank everybody. I also want to just remind everybody that the state is here to support. We're doing everything we can behind the scenes and obviously even up front to lead on this. And I want to thank Governor Inslee with the announcement yesterday, because that announcement, I do think, is going to remind everybody about how important it is for all of us to work together as we move forward. So we will pick it up next time. And again, thank you to our media partners. And I will, Julie, turn it back to you to close.
Thank you very much, everyone. Thank you for attending today. And our next briefing is scheduled for January 19th.